Dr. Lungan Rongmei. I'm from Assam. During the clinical attachment, we start our day with a case discussion with Santala ma'am. We review the case and then we see what are the protocol followed, and then we do a discussion based on that patients, what are the things we could do better, what are the investigations, why it is done. So we do the discussion. Followed by case discussion, we go to the OPD, Anu ma'am's chamber, where we see how we counsel the patient. We get to see many difficult cases such as patients who has gone to multiple IVF and multiple IUI but they have failed, so they come in this center for the treatment. And we have seen many difficult cases such as decreased ovarian reserve, premature ovarian failure, how ma'am has counseled them, how the individualized treatment protocol has been decided for each patient. And then followed by that, in between we go for the ultrasound scanning, where we got to see how to detect endometrial receptivity by checking the endometrial thickness, how to see the endometrial vascularity, zone 1, zone 2, zone 3. Also, we got to see how to do the monitoring folliculometry and how to decide according to that what will be the dose of the trigger, what will be the different dose of gonadotropin. After doing the scan, we go to the OT. Because of the simulation, we are already aware of the procedure. We got to see many cases of ovum pickup, embryo transfer, many hysteroscopy scanning, how the natural killer cell biopsy has to be taken for NK cell and how ERA has been done. And we got to see the different method. Like we have read in the book how ERA is done. But here how the patient has been given progesterone, then how ERA has been taken, how to interpret the result, all those practically we got to see after coming here for the clinical attachment. Because we have gone through the books, that was all theoretical. But after coming here, we are getting to see the practical aspect, like yes, ERA is done in this way, diagnostic hysteroscopy is done and biopsy is taken, and how they will proceed for the natural NK cells assessment. And during the ovum pickup also, what are the prerequisites they have to do. We have learned it in the book, but practically when we get to see, we get to remember it more better. We have to make the bladder full, then the patient is taken into OT, how the ovum pickup is done, what are the precautions, what are the tips and tricks that we have to follow to avoid any complications. And after the ovum pickup, what are the precautionary steps we have to take. So all those things we get to see and then learn so that we can follow it when we go back to our center. I am very thankful to Medline Academics for all this opportunity and for learning and for making me more progress towards infertility.